Welcome to Healthcare APPtitude, where healthcare's thought leaders will examine ways to address the rising costs of care in America. We'll also examine how the latest advances in mobile apps are helping hospitals and health systems bend the cost curve and improve patient engagement.
Hi, and welcome to Healthcare APPtitude. I'm Tom Testa. I'm excited to join the show again to moderate another very timely discussion with two experts and friends from MobileSmith Health. Today joining me are Bruce Kennedy, VP of Provider Development, and Ashey DuBray, Director of Provider Development. Folks, welcome.
Well, thank you, Tom. It's good to be with you again. Before we get started, I just want to extend our thoughts and prayers to all the folks on the front line that are dealing with COVID-19 on a day-to-day basis in the healthcare sector and space and care delivery environment, but also to their families and to the many, many families, the listeners who are not involved in direct healthcare provision that are experiencing right now. Certainly as the number of infections grow and the number of lives that are impacted, it produces a level of stress in our communities that is untold, that we all experience in one way or another. So just want to say our thoughts are with those folks on the front line and dealing with COVID in a more direct basis. And we hope that more communications like this allow the conversation to help those organizations move forward, no matter what obstacles they're dealing with as it relates to the new COVID normal.
Well said, Bruce. It's funny, here we are again on another episode, and the theme of the background here is going to be COVID-19 again. And, again, we're not sure. Will this be something we'll be talking about 3 months from now, 6 months from now? Who knows? But you're right, it's impacted so many of us. Well said for all those on the front lines. Bruce, Ashey, I want to kick things off. Talk to us a little bit about what's happening at MobileSmith Health. I know there's some great stuff happening, and also maybe a little bit on your take about what's happening in the mobile app market in general. Bruce, did you want to kick things off?
Yeah, absolutely. Thanks, Tom. Fortunately and unfortunately, now's a really good time to be in the mobile app space, right? So we have a scenario where you have an increasing number of patients, all right, who need to work more remotely with their care providers. You have a number of almost every care provider out there who, in order to manage and risk mitigate around COVID and other infections at this point, are now more of a mind to get involved in levels of telemedicine that they may not have been involved with prior to COVID. And so there are wonderful things, wonderful products being born out of this horrible pandemic that are focused on improving the delivery of care in that patient journey, but also improving the ability for care providers to work remotely. And by that remote work, actually have a better bead, a better idea what's going on with their patients day to day. And so I think if there was a silver lining in this at all, and it's hard to imagine what that would be at this point, it is that you are seeing levels of efficiency work their way into our care delivery processes that were not there before. And because mobile is device-based, because mobile is easier to use and access more than ever before, you do see a place for mobile in this space that is just rising. It's incredible. And so for us, we've been able to develop new products that support those hospitals dealing with COVID, like our COVID response products, which are communication outbound products, and our COVID Clear product, which is a employer attestation product. We have developed products that are focused on improving healthcare delivery. But because our COVID Clear product is focused on employer attestation, it's also opened up an entirely new market of just an employer base for us to work with. And so, as we'll no doubt get into in much more detail, we're seeing a lot of activity from non-hospital entities that want a mobile health attestation app so that they can successfully bring their employees back to the office.
That's excellent. And Ashey, what your take on the market, and again, a play on what Bruce was saying, how COVID has presented, this opportunity where, mobile is really coming to the forefront here. What do you see happening in the market?
I think access to mobile devices is something that many of us have. And in the care delivery setting, it just improves care delivery and increases access of patients to their providers, providers to their patients, employers to their employees, et cetera. So when we came into the market with our COVID response and COVID attestation apps, it was in response to what our clients and different industries were asking for. So it's been a great opportunity for us to start working with industry that we didn't typically work with, but also respond to their needs, hear their needs, and then be able to evolve their human resource policies and their communication patterns in a way to quickly and efficiently communicate to their employees, their patients, et cetera, and allow them to quickly communicate with their providers and their employers.
Excellent. Today, on today's show, we're going to be exploring how many providers are looking to get back to the traditional business of medicine. Specifically, we're going to talk about urgent and elective surgical procedures within hospitals and ASCs. Bruce, can you discuss the impact on hospitals and ASCs? Some of them have had their doors closed for the last couple months, and now they're looking to provide a safe environment for a lot of the patients that are coming back to these procedures.
This is a really thorny conundrum that hospitals find themselves in right now, especially depending upon where you are in the country, right? As you look at the level of resurgence of COVID-19 infections, you see certain states having to take a few steps back in their reopening process. And that's a direct impact of the increased number of hospitalizations and patients who require a higher level of care. And that obviously is beginning to press on the scarce resources that hospitals were already dealing with in terms of even ventilators and PPE. It is how a hospital has to operate in the new normal. And so now you have probably maybe no more than 10 states where hospitals are able to look to returning to a level of elective surgery volume normality, all right? But the remaining 40 or so states are still struggling with that because they're seeing those increases in hospitalizations. And that's going to directly impact your ability as a hospital to deliver the number of surgeries, elective surgeries that you were prior to COVID-19. I think that there are a few areas that are going to be of importance to get back to, but I think that when your hospital is relying upon 60% of its revenue to come from elective procedures, in most cases, COVID-19 has you in a lot of financial trouble. You're losing a significant amount of money every single day when you can't get a certain number of procedures done. I think the Kaufman Hall report points to that in terms of just in the month of March, how hospital profits just kind of went right through the bottom. You've got increased labor costs, you have increased equipment cost, you have a massive amount of overtime that's being generated by your labor, and you're no doubt struggling with having to pay for higher cost providers and higher cost nurses. Travelers that are negotiating contracts are just through the roof because they're in such demand right now. So you're talking about an environment where the margins were fairly thin to begin with, and now they're truly struggling. So there's some urgency to figuring out, hey, how do I balance my COVID-19 surge or resurgence with an operation that allows us to successfully begin to spin back up our elective procedures. And, while the hospitals are fairly thin on margin, I think ASCs are even more set upon from a financial perspective. Ashley, that's your area. How do you think ASCs are faring now?
Not well. ASCs make on average, if you just look at Medicare reimbursement, about half of what hospitals make on the exact same procedure. So although their overhead is less overall, their reimbursement is significantly less. And when you look at things like implant prices, those prices don't change whether you're at an ASC or a hospital. So they've had to roll out some significant changes to their process because ASCs rely solely on elective surgeries, and they don't have procedures that are urgent or emergent procedures being performed at the facilities. And as Bruce mentioned, their margins are so minuscule compared to the hospital's margins. It's a really difficult time. There's also been a trend for ASCs to partner with hospitals. And so these hospital and ASC or physician and ASC partnerships where the ASCs are owned by physician groups and partially owned by hospitals makes it even more difficult.
So, and Ashley, so let me ask you too. So it sounds like, COVID has changed potentially or not the business model for how ASCs operate and potentially even the amount of services they provide, or, what are you seeing on that end?
Yes, it really has. So I think about our rules in our ASCs, the things that were required of patients prior to their procedure or during their procedure.
Mm-hmm.
Those things have changed. Right now, patients are being tested on average of 3 to 5 days prior to their procedure, and then they're self-quarantined. They're being required to self-quarantine until their procedure, so they're not potentially exposed to COVID. They're doing additional screening on the day of surgery in ASC, sometimes even in the patient's vehicle. Plastic shields between registration desks. The patients have to wear masks all day.
Mm-hmm.
The visitors that we used to require in the facility in case there were any complications in the procedure, and to ensure that the patient had someone to drive them home after their procedure, they're no longer allowed in the facility. They're required to stay in their cars in the parking lot, which is not something realistically we can monitor. And then that pre-admission testing that our anesthesiologists or nurse care teams would do prior to their procedures, a lot of these things are having to be done in a telehealth manner. So while patients still need to get their lab work prior to a procedure, it may be difficult for them to get all of their clearances needed for certain procedures if they're not able to go to their pulmonologist, cardiologist, etc.
Because of what you just said, the laundry list of things to be safe, to be healthy. I think this is why we're seeing a lot of folks actually just putting off elective procedures too.
Absolutely. Consumer confidence is down. And what's incredible, being someone who's worked in hospitals and worked in ASCs, our disinfection processes and protocols, they aren't changing. Hospitals and ASCs do these things right. They're thorough, they're efficient, they do a great job of keeping patients safe in the facilities. Really what they're focusing on is making sure that only healthy patients are entering those facilities so they can't expose others. So it really is difficult for them to instill consumer confidence when, yes, they're changing their policies and protocols to make things safer, but they have many, many requirements on their sanitation and cleaning and sterilization protocols that haven't changed because of COVID, because they were strict to begin with.
Now, Bruce, back to you for a second here. How do hospitals, how do ASCs, how do they kind of instill that consumer confidence that Ashey was talking about, so folks do, even when the open sign is hanging there on the provider's office, that they do go back and still start to get these elective surgeries going?
Well, a lot of it, Tom, is based upon fundamentally the relationship that hospital or health system has with their community.
Mm-hmm.
And that bridge of trust, or that platform of trust rather, allows a hospital to develop communications that are believed when they go out, right? Unfortunately, given, I think, the over politicization of COVID-19, I think this is probably the first time in at least that I can remember, and maybe in our history, that we've had such mixed information sets around a major issue like this, a major health issue like this. And so I think that communities are getting a lot of mixed messaging right now. I think it's incumbent upon the hospital to have a very efficient, very comprehensive communication program that allows them to basically start or restart their relationship with the patients they have out there, and to be able to cut through the noise of misinformation that is out there about the infection, how the infection is spread, because patients have to feel confident about making that trip to their hospital. At this point, patients are about coming outside their doors in some communities. One of the kind of the untalked about problems of this pandemic as it relates to patients and hospitals are the amazing drop in stroke and cardiovascular emergency cases coming in throughout the pandemic, and
right.
and the number of patients who were trying to avoid even coming into the ER and getting sicker and dying. The only thing that really should have been impacted in terms of ER volumes would have been trauma, because with less cars on the road, you have the opportunity for less accidents, therefore less trauma.
You're listening to Healthcare Aptitude on Healthcare Now Radio, and I'm Tom Testa. In today's episode, I'm joined by Bruce Kennedy and Ashey DuBray of MobileSmith Health, and we're discussing the need to bring normalcy back to urgent and elective surgical procedures for both hospitals and ASCs. So folks, we spent the first half of our show talking about how these hospitals, these ASCs, how they can get back to business, or actually why they need to. Quite frankly, they need revenue, but also patients do need some of these procedures. They may be called elective, but folks still need knee replacements. They still need things to bring quality of life back. So you mentioned during our pre-show discussion that there are 4 obstacles that hospitals and ASCs must overcome when looking to reopen.
let's break those down for listeners if we can. Bruce, can we start with you?
Absolutely. The first is a hospital's ability to increase their testing capacity for patients and staff. This seems like a no-brainer, but I will tell you now, with the challenges in some hospitals in certain states and cities procuring PPE and materials, there's also a scarcity of testing. There's also been an incredible amount of misinformation around testing kits, testing availability, even in some cases testing viability, right? With a number of patients and staff who are on retest or testing negative, and then all of a sudden testing positive. So there are a lot of challenges around testing, and I think that as we begin to better refine our testing process, the challenge which is do we have enough testing going on? As Ashey mentioned earlier, that ASCs are commonly testing 3 days prior. And I imagine that part of that's protocol, but also part of that is availability to test kits and how fast a test results can be received in a reliable fashion. So I think increased amounts of testing, test capacity, and testing validation for both patients and staff is something that has to be fundamental to being able to drive a level of consumer confidence and risk mitigation that allows you to spin back up your number of elective procedures.
And that brings us to the second obstacle. Ashey, I know you talked about this earlier, but again, easing patient concerns. Can you expand on that a little bit more for us?
Sure, absolutely. Consumer confidence is something that hospitals and ASCs are struggling with right now. So the focus really has been on improving communication between patients and their healthcare providers to make them feel safe and secure coming into this hospital or healthcare setting.
And Bruce, we've talked about consumer sentiment and confidence, increasing testing capacity. A third obstacle here is managing the surge. And again, this is personal or maybe not. Can you talk to us about that?
Yeah, so here's the real big challenge that I'd say probably at least close to 2/3 of states are dealing with now, is that they are now going through levels of surges. There was a lull a bit after social distancing and some of the quarantine efforts were implemented. And the way in which we have opened up certain areas of the country, certain states, predictably has caused a new surge of hospitalizations to occur. Hospitals knew this was coming, and that's why you're seeing a level of better preparation than maybe we had when we didn't know how things were going to go in New York and in other parts of the country that experienced this more heavily at first. And so admittedly, we're doing a better job of managing the surge now than we were before. Mm-hmm. I think one of the big challenges now is managing a sustained surge. The surge implies that there is a peak and that there is a bottoming out. And I think what many hospitals are experiencing now are kind of mini surges or a ripple surge or a wave level surge where the peaks are smaller and it's happening over more of a sustained period. And that creates incredible stress on personnel. And so, now you have hospitals that are having to become very creative with how they manage ICU beds and observation beds in their ER units because of the amount of patients that are coming in. And I think the same rules apply as they did prior to the second surge or second wave, which is a high degree of communication between multiple departments within your organization. I think a high degree of communication between other hospitals that are in your community or in your region so that you can share some of this load. And I will say quite readily that hospitals are the environments to do this in, right? Even prior to a pandemic, hospitals were always training for they were training for pandemics, never one like this, I don't believe, but they were training for natural disasters, major trauma incidents where you had to have a high degree of collaboration between multiple health systems in your region, along with a high degree of communication within your hospital or health system in terms of managing the incoming patients. So, there couldn't be a better organization to be able to deal with a pandemic, not for the fact that they're clinical, but also because they're built around the management of various surge levels.
And Ashey, let me bring it back to you for the fourth obstacle that we talked about kind of pre-show here, and it's becoming more efficient. ASCs and hospitals need to do that. Can you talk a little bit more about that?
Sure. Efficiency is a struggle that hospitals and ASCs continually have, but now they're faced with a backlog of cases. So revenue cash flow is affected, and they need to do whatever they can to avoid costly cancellations or any preventable readmissions. Because again, going back to those margins are tight. They really need to optimize surgical and procedure rooms and their personnel. Scheduling can be difficult when they have a high rate of cancellations. They're trying to fit in all of the patients that should have been done for the past few months due to that case backlog. And it kind of it becomes a very difficult game to optimize efficiency while also optimizing revenue.
That's a very good point. And it kind of brings me to the main reason why we're all here, too. In terms of getting them back online and overcoming these four obstacles, the main question is how can mobile apps help?
We at MobileSmith know that smartphones are used by nearly everyone. And on average, people use 9 apps every day and 30 different apps in a given month. So a health app from hospitals or ASCs is a natural fit. Our clients utilize our apps to list their hours, the locations of their clinics, their ER wait times, physician directories, driving directions, etc. So we house all of the information that healthcare providers want to communicate to their patients and allow them to do that in a manner that patients look to for information.
Bruce, your thoughts on that too? How else can mobile apps play into getting these hospitals and ASCs back online?
Because of the ubiquitousness of the mobile devices at this point and the high levels of utilization, combined with our ability now to easily integrate mobile applications or mobile app access into a patient's electronic medical record, we now have the ability to pull out relevant information from a patient's medical record and begin to help providers create a better experience for that particular patient. So we're now in the realm of personalized assignment or personalized prescription of medical instructions that you would get from your provider would give to you to help you better prepare for an upcoming procedure, right? So vis-a-vis that whole ability to manage patients remotely, right? So we're no longer having to sit in front of a patient, talk them through an upcoming procedure, and then kind of wait and hope and pray that they do everything they're supposed to do.
Right.
We now have the ability to prescribe an app to a patient that is based upon their unique set of surgical circumstances, such that they now have a roadmap by week up to their surgery and a roadmap by week after their procedure. So we're not just covering, hey, how do we get you in here more confidently and make sure that you have a complication-free procedure, but we're also looking at ways to better manage that patient on the back end of their procedure so that we see better outcomes and have a much more successful patient journey overall.
We often hear the word, adherence too, with these apps. So talk to us how they help patients adhere to these procedures and the list of, pre and post-op directions that come with it.
Yeah, well, patient adherence is really an umbrella term for, listen, you need to do what your doctor tells you to do. And for, long before we were alive, care was being delivered in such a way where a physician provided the patient with the information and basically hoped or assumed that they would follow the pre-surgical instructions and post-operative instructions. Over the course of many, many years, you find that there are varying levels of patient adherence depending upon the patient, their circumstance, their socioeconomic background. A lot of factors influence patient adherence. One of the factors that can most influence patient adherence is accessibility to your instructions, the ability to check off your instructions and then have someone provide a level of oversight to what you're doing. So with our applications, our peri-op applications, it's not just that the provider gets to push or prescribe you a series of instructions around patient adherence. The provider also knows as you're checking off those things that you've completed, the provider has a heads-up dashboard built in their EMR, as integrated to their EMR, that allows them to see how you're doing. So your doctor, your nurse, your surgical coordinating team can see whether or not you are doing the things you're supposed to do to get ready for your surgery. And if you're not doing them, then that allows the provider provider and the provider team, the caregiving team, to make decisions about what to do. They now have an early warning system so that they can intervene and help you recover to get back on track for your upcoming procedure or appointment. But they also now can make better decisions around how to utilize that OR block in that time. So perhaps you're at a point where we need to look at changing your procedure day because you've just gotten so far off track. But if you're utilizing comprehensive peri-op applications like our peri-op application, then you're going to be able to have an early warning system for around your patients that give you a better control and management over how to treat them, how to get them prepared for their upcoming procedure.
Just to add on to what Bruce just mentioned, so 3/4 of same-day cancellations are attributable to inadequate patient prep. So just a modest improvement to the no-show rate, that same-day or near-day cancellation rate, can save facilities on average almost $200 per procedure. And then on the back end, mobile apps that clarify patient discharge instructions have also been shown to reduce preventable readmissions, and that's a savings of at least $100 per procedure.
You know, it's a great point about the preventive readmissions. I mean, we're talking about this happening amidst a pandemic. So the less time in a hospital or a healthcare facility right now, the better for, I think, a lot of patients. Any final thoughts as we wrap up today's show?
You know, I think this is a really big issue, clearly. And I think that this is something that if history holds true, this will not be our last major outbreak of some type of virus. And so our systems are going to have to be able to put in structures that allow us to be more flexible, to deal with these types of pandemic management issues. And I think that is only accomplished by really tapping into layers of technology that are at the heart of how we operate as humans now. And there's no more operative technology out there right now for most humans than their mobile device. And so I think it's up to healthcare systems and I think technology companies like MobileSmith to come up with ways to kind of bridge those things together, right? There are a lot of things that we can do in the mobile space right now that help not just drive efficiency into the process, but are really focused on how do we change the current care pathway? How do we develop products that are completely aligned with your hospital's care redesign process? And mobile has the ability to do that because it is inexpensive and it's flexible to develop.
Well, Bruce, Ashley, this has been a fantastic discussion. Thanks very much for joining us. That's a wrap for this month's episode of Healthcare Aptitude. Be sure to join us next month as we investigate more about the use of mobile apps in healthcare. Remember to catch the show on Healthcare Now Radio every weekday at 7 a.m., 3 p.m., and 11 p.m. Eastern Time. For more information, visit www.mobilesmith.com or send your questions to sales@mobilesmith.com. Thank you for listening and be safe out there.
Thank you for listening to another episode of Healthcare Aptitude, sponsored by MobileSmith Health. Be sure to tune in weekdays at 7 a.m., 3 p.m., and 11 p.m. Eastern Time on Healthcare Now Radio.